Now, Africa as a region has the second lowest number of positive COVID-19 cases at more than 14,300. The death toll stands at around 750. Three of the continent's top 5 economies, South Africa, Egypt and Algeria, have the highest number with nearly 40% of positive cases between them. South Africa has 2,173 cases. Egypt is just 71 cases from reaching the 2,000 mark, and Algeria has reported 1,825 cases. And we'll be joined on the line by Africa Analyst Advocate Sipho Mantula, a researcher at the Institute for Dispute Resolution in Africa at the University of South Africa. And I'm getting advisory that he's already on the line. Advocate, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Thank you. Simple evening even to the viewers, Jumbo Africa.
First of all, let's talk about the African Union Special Envoys appointed by the AU Chairperson, President Cyril Ramaphosa. I mean, their task is to mobilize international economic support for the continental fight against this virus, and will surely be a difficult one, given that all countries are fighting for the same resources.
That is quite true, Simpiwe. I think this is the great move done by the president, because the other challenge of this virus is that it has affected economic growth and even economic challenges in many countries. But I think what is very critical, again, it is for this envoy as well to assist in terms of dealing with the issues of the deaths, dealing with the issues even of the continent, dealing with the, one can say, challenges that are of health infrastructure. Remember that one of the key areas has been around the health infrastructure. So one will say that these are the former finances ministers who will understand that the issues of health budgets have to be focused on.
Now, what do you make of the story of African nationals being targeted in China? I mean, African ambassadors in China, they have spoken strongly against this kind of treatment. So will this, in a way, sour the relations between China and Africa?
No, they will. But remember that China is part of the BRICS, and as well as the Ministry of Foreign Relations today issued a media release as well, condemning such actions about how Africans are being treated. The AU as well, during this week, came out strong about the relations and the accusation of the African nationals who are in China. So you will understand health organizations have raised the issue of not politicizing or as well as ethnicizing this virus, because once you are putting it into ethnic groups, even if we know where is the origin, then Africans are now finding being victims in the foreign countries, as well as the issues of the global solidarity. Because what we need now is the global solidarity and the global support of everyone who is trapped wherever he is.
And picking up on that point, Advocate, the WHO Director General, Dr. Tedros Ghebreyesus, lamenting the politicization of the COVID-19 virus and receiving AU solidarity. But why does it seem like Africa is always on the receiving end of those looking to deflect attention from their challenges?
That is quite true, Simple. But let us look even at the issue that came out from whether it is the superpowers from America, from Asian countries like Taiwan, as he was alluding during, it has been challenged again at the lead of such institutions. But at the same time, like I will say to you, there were many African leaders who have been part of the UN agencies, from your Kofi Annan, from your Boutros Ghali. But now it is said that when Africans are supposed to be leading a global campaign or a global response of this nature, are being now haunted, are now being accused, So for me, it is the issue around how do we even deal with the superpowers' arrogancy and even their global posture? Because we will understand that even the issue of Trump trying to say we will even reduce the money, it is not for the continent, but it is for the whole world, because this virus has affected, as you are saying. I think the World Health Organization was around the issue that was on the news this week around the testing, because the issue of using vaccine and testing in the African continent when numbers are even very low. Because earlier, when you were saying we almost less than 14,000, but when you look at Europe, there are more numbers actually compared to the continent.
Now, closer to home, Advocate, Botswana president and his cabinet have undergone quarantine, and there's a state of emergency in that country. What does this tell us about that country's readiness to fight COVID-19?
You know, I think they've been very active, but you will understand that some of the MPs have been delinquent as well. Simply, they've been given days to go home, but others were seen shopping. And then that is another challenge that government has been pushing. But remember that they were avoiding to use other laws in that country, that they have opted to use the state of emergency as part of curfew regulation, as part of dealing with the people's movement. But at the same time, learning from South Africa by looking at the issues around the goods, the food, allowing people to go to their shops, allowing the borders to be open. So one will say, when you look at Gaborone, Botswana has been having low cases, but I think they are much more looking at South Africa and neighboring countries. How are they dealing with this virus? So one can say that if you look at Botswana, it is hosting the SADC region, and SADC, it is one of the regional bodies as well that is even responding to this virus.
And surely South Africa's efforts of containing this virus haven't gone unnoticed, especially by the international community, with President Ramaphosa being hailed and lauded for his bold and decisive action, with the Health Minister, Dr. Zweli Mkhize, and his team being knowledgeable on the issues surrounding coronavirus and, of course, being sober-minded with regards to giving the daily updates on coronavirus and the infection rates. Now, South Africa has also extended the lockdown for another 14 days. Any lessons to be learned by other African countries?
I think we will remember that once we declared the national state of disaster on the 15th of March, most of the countries followed suit from us. When we went on regulations and on the curfew and on pushing the lockdown, we saw countries like Zimbabwe following suit. We saw countries like, one can say, Namibia following suit. So you can see that even in West Africa, in East Africa, they've been looking at us as we are leading the African Union. But one can say that the challenges have been around the issues around coordination and communication. As you have been saying, that the lessons many countries must pick up is the issue of communication and coordination. Like West Africa, you are still having challenges of presidents who are not visible, who are not giving regular updates. And again, the issue around understanding the plight of the poor. Simply, I think the lesson then is how do we push social support and social assistance to the poor and needy in this period, rather than looking at maybe running with us being on the media, but not at the same time doing what we should be doing as part of social support, and as well as insisting on running away from pushing fake news, and at the same time getting into the challenges of our health infrastructure and our health and our wellness in the country. Because I think as the country, lessons to be learned again is how do we deal even with the travel ban on the high risk. Because many of African countries have been allowing the flying of in and out of European countries until they saw from South Africa that we have already banned the international travel from foreign countries. So that is one of the key lessons. And finally, like I said, simply to look at the law critically, to say that how do we even relax the law rather than changing regulations time and again, because you end up confused the issue of your curfew, at the same time trying to give, one can say, reasonable accommodation to other essential service workers.
Certainly, Africa has got some advantages in terms of, dealing with the outbreak, with the experience of the Ebola outbreak, with the malaria outbreak. So can African countries use that kind of experience to their advantage in dealing with COVID-19?
No, definitely. But strange enough, since you're talking about Ebola, by this week we were supposed to be saying we are free of Ebola, but it has now erupted in DRC Congo. But like you have said, all these vaccines and the man-made diseases have affected even development and growth, because the issue again, it is the issue around the health infrastructure, Sipho. But in the African context, it has been the issue of the social support that communities have been giving to their families, government have been giving to, rather than using the word social distance, Sipho. There's a new terminology saying we should be using the word social support, because we should be saying physical distancing, not social distancing, because the more as Africans we move away, because of our Ubuntu has emphasized that in Africa we were able to deal with that. And finally, simply, I might not have raised the issue of indigenous knowledge system, because that is the cry from different African countries that why don't we integrate the use of our African herbs in dealing with this influenza or this common flu that is coming under the pretext of coronavirus disease. Because even in Ethiopia, in China, Sipho, I can assure you the use of the African herbs was there. But if we look at West Africa, East Africa, they were using herbs to fight malaria, to fight Ebola, rather than looking at the vaccine and looking at the drugs only.
And the damage of the global outbreak has had on the African continent will be much more severe. And not the same can be said about Western governments, which will also be looking at the aid programs that will sort of cushion the sectors affected by the outbreak. So is this possible for Africa? Is there a plan B post this pandemic?
Simply, any government that has gone under humanitarian disaster normally have what they call a post-mortem and a post-recovery plan. Now, when you look at the African continent, there is no need to be rushing to the IMF, to the World Bank, but it is what we have seen lately by African heads of state, cabinet ministers cutting their salaries for 3 months. We see local leadership in different municipalities cutting their budget. So the issue for the continent is to look at the economic growth, but even how to deal with such epidemic that becomes a pandemic, Sipho, and to ask ourselves, where is our health knowledge systems? How do we miss it when it was starting in December and comes March? Then many of the African countries are limping, are not aware what will be their plan B, because some of our African governments are so corrupt in the sense that their health infrastructure is lacking, and secondly, there is even corruption in a humanitarian disaster. So we need to guard against even corruption in this humanitarian disaster that is currently going on. And the issue of even communication is very key, Sipho, because the issue of the use of force, it will not assist us, rather than trying to communicate to the people about the challenges that we are facing, even if there are many views about how this virus has affected economies of China. Because remember that China was an emerging global player, and hence America felt that China cannot be superseding them. So one can say that there are those international relations squabbles that you see about America and China, and Africa becomes a victim of the circumstances. Even if our numbers are low, the estimations are pushing us by July, August that will be having the high numbers. But I think resilience and even solidarity is what African governments and their own community members must contribute to any solidarity fund that is needed.
Advocate Sipho Mantula, as always, we appreciate your valuable insights. Thank you so much for chatting to us this evening.
Thank you very much, my brother. Asante sana.